So in this video, I will be presenting my knowledge translation product, which focuses on ethical decision making for paramedics who are treating patients who are in police custody. This tool was inspired by the Jeffrey Bates case, and it is used to help paramedics recognize bias, apply ethical principles, and make decisions that center the patients at the core of them. I feel like this is an important issue because a lot of the times patients who are in police custody are at an increased risk for their complaints being minimized by healthcare workers. And when it comes to the case of Jeffrey Bates, he was a paramedic working in Tennessee who was called to a foot pursuit, which ended up in someone being arrested. And the person was complaining of hip pain, but because Bates didn't take this complaint seriously and didn't transport this person to the hospital, they were diagnosed later than they should have been for having a fractured hip. So while Bates was wrong for what he did in this case, I think it highlights a bigger issue of how personal biases can cloud the judgment of healthcare workers and specifically paramedics when it comes to dealing with patients who are in police custody. There's a good chance that this wasn't the first time that Bates had seen a person in police custody and they were faking an injury. So he might have let his previous experience get the better of him here. So my tool is essentially using ethical concepts and it translates them into practical guidance for paramedics. So one of the first concepts we talked about was the consequences of prejudice and showing how bias, assumptions, and prejudice can lead to things like dismissing complaints, um, delayed diagnoses, increased risk of patient harm and furthering injury, things like that. The next thing it discusses was ethical principles such as beneficence, non-maleficence, autonomy, and justice, which are all guidances and things that can help moral compasses to make better decision making for paramedics. These principles also help to maintain the thinking that these patients are not detainees, but they are patients and they still need to be treated as such. They still need to be assessed the same way. They still need to be spoken to the same way. They still, if they have a real complaint, need to be transported the same way as well. The next thing the tool spoke about was common mistakes. So things like allowing prejudice and assumptions to influence care, or even things like failing to perform a full assessment because you may not be in control of the scene or the patient might not be allowing for it. You have to work around these hurdles. And just because a person is in custody doesn't mean you as a paramedic don't do your job. And the most important thing it discusses is it gives guidance on what should be done in these situations. So things like conducting full assessments, advocating for the patients, speaking to them with dignity, treating them like a normal person, and basing your decisions for treatment and transport on clinical findings rather than just guessing and assuming. It also connects all of these things to some Ontario standards and laws, so things like the BLS and the Healthcare Consent Act to ground the guidance in some legislature for these paramedics as well. I think this is a really important tool because it's very easy to become dismissive of patients like these because they may not cooperate or they may have done things that are wrong. But even if that is the case, it should not be changing how we as paramedics do our job. So this tool will help you manage your bias and it will also reinforce the importance of patient advocacy and ensure that your decisions and the conclusions you come to are based in you doing your job properly because you didn't let bias get in your way, rather than just assuming things will go this way because it's a police call or I've seen this patient before. You do things properly, you come to the right decisions, and everyone is properly treated in that situation. You're doing your job, the patient is cared for better, and we maintain that good patient and healthcare provider relationship. So while this tool helps you to recognize these things and how to best combat them, the first step is to see what's happening here and understand that even if this in this case we're speaking about police custody patients, you don't let bias get in your way. There's lots of people who have been working for a long time. They've seen a lot of the same calls over and over. It's easy to let your bias cloud your judgment, but this will emphasize the importance of staying objective and prioritizing patient care in these situations.